Hi everyone, welcome to the Paul Chandler Show. I'm your host, Paul Chandler. In tonight's discussion, we're going to be talking about major depression. However, we're going to be doing it in an animated way and also going on the clinical aspects of major depression. So stay tuned and we'll be right back. Hello everyone, Captain Awesome here again, and today we're going to talk about major depression. Now, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. More than just about having the blues, depression isn't a weakness and you can't simply just snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and may include feelings of sadness, tearfulness, emptiness, or hopelessness, angry outburst, irritability, or frustration, even over small matters, loss of interest or pleasure in most or all normal activities, such as sex, hobbies, or sports, sleep disturbances, including insomnia or sleeping too much, tired and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss or increased cravings for food and weight gain, anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, feeling of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts or suicide, unexplained physical problems such as backaches or back pain, or possibly even headaches. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities, or relationships with others. Some people may feel generally miserable or unhappy without really knowing why. Common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be a difference. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. Depression is not a normal part of growing older, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleeping problems or loss of interest in sex, not caused by medical condition or medication, often wanting to stay at home rather than go out to socialize or doing new things, and possible suicidal thinking or feelings, especially in older men. If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you're reluctant to seek treatment, talk to a friend or loved one, any healthcare professional, a faith leader, or someone else you trust. If you think you may hurt yourself or attempt suicide, call 911 or your local emergency number immediately. Also consider these options if you're having suicidal thoughts. Call your doctor or mental health professional. Call a suicide hotline number, and here in the United States, you can call the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255. Using that same number, then press 1 to reach a Veterans Crisis Line. Reach out to a close friend or loved one, or contact a minister, spiritual leader, or someone else in your faith community. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person. Call 911 or your local emergency number immediately. Or if you think you can do safely, take the person to the nearest hospital emergency room. It's not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences, brain chemistry, hormones, and inherited traits. Depression often begins in the teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment. Factors that seem to increase the risk of developing or triggering depression include certain personality traits, such as low self-esteem or being too dependent, self-critical or pessimistic, traumatic or stressful events, such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship or financial problems, blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide, being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that aren't clearly male or female, known as intersex, and in a supportive situation, history of other mental health disorders such as anxiety disorder, eating disorders, or PTSD, post-traumatic stress disorder, abuse of alcohol or recreational drugs, serious or chronic illness, including cancer, stroke, chronic pain, or heart disease, and certain medications, such as some high blood pressure medications or sleeping pills. And you should also, though, just a reminder, talk to your doctor before stopping any medication. Depression is a serious disorder that can take a terrible toll on you and your family. Depression often gets worse if it's not treated, resulting in emotional, behavioral, and health problems that affect every area of your life. Examples of complications associated with depression include excessive weight or obesity, which can lead to heart disease or diabetes, pain and physical illness, alcohol or drug misuse, anxiety, panic disorder, or social phobia, family conflicts, relationship difficulties, and work or school problems, social isolation, suicidal feelings, suicide attempts or suicide, self-mutilation such as cutting, and premature death from medical conditions. Now, while there's no sure way to prevent depression, however, these strategies may help. Take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening. And consider getting long-term maintenance treatment to help prevent a relapse of symptoms. And that's all the time we have today to talk about major depression. But before I fly out of here, back to you, Paul, at the Paul Chandler Show studio. Now, I hope I don't break the ceiling, but bye-bye now. And thank you for watching that education moment on major depression. Tonight's episode of the Paul Chandler Show is brought to you by Clear Physician Services. Again, I want to thank you for watching and have an awesome rest of your night. If you like this video and want to see more, make sure that you subscribe to our YouTube channel.
It's so easy. It's right there. A little button. Just push it. Subscribe. I got all night. Nothing else to do. Just subscribe.